During the first dive of this SNSI Rescue Diver course, you performed exercises to develop your individual ability and help you reach super autonomy. In this lesson, you will learn how to help a partner in difficulty and how to carry out an underwater search. At the end of this dive, you will be able to transport a buddy to the surface in a variety of ways, as well as treat a cramp at the surface or underwater, both for yourself or your partner. You will know how to help a partner who is panicking, carry out a proper search, give support to a tired partner, and properly launch a lifesaver or first aid buoy. As a rescue diver, you could find yourself in need of helping a diver in difficulty. You could surface far from the boat or the scheduled pickup point with a diving buddy who is too exhausted to reach the pickup point. There are a variety of techniques you can use to easily help a partner in distress. By holding on to the tired diver's valves, you can swim on your back. This will also help you protect the partner against waves arriving in the direction you are swimming. Ask the partner to keep the air supply in their mouth and talk to them to let them know you are there and that you are giving them needed assistance. Another way to transport a buddy is to push the diver by their fins. Rest their fins on your shoulders. Put your hands on their knees in a way that the legs stay straight and swim by using a fluctuating kick. Make sure that you have adequately inflated both of the BCDs so that you are well supported on the surface of the water. If you have difficulty, always remember that you can always remove your weights and ask your partner to do the same. Carrying your buddy on your hip allows you to stay closer to the person in distress. It can be very useful for transporting a partner after a panic attack. The nearness and the visual contact provide relief and help reduce anxiety and eliminate panic. You can also use a float. If you need to help a diver in distress, the best idea is to take along a float. It gives a diver the possibility to hold onto the float, and you will be able to transport them with higher safety for both of you. If you have a leg cramp, the best solution is to take the tip of the fin in your hand and extend the leg while massaging the sore area with the other hand. Even when you are on the surface, it is a good idea to keep the air supply in your mouth to avoid accidentally inhaling water. The other possibility is to ask your partner for help by having them perform the very same maneuver. The technique to treat a cramp under the water is just about the same as treating a cramp on the surface. When you need to treat a cramp underwater, be careful to maintain neutral buoyancy and your breathing rate. A painful event like a cramp can increase your breath rate excessively and lead to breathlessness. If you treat your own cramp, remember to breathe slowly and deeply to avoid losing your breath. If you are helping a partner, check that they are breathing correctly. If you see that they are breathing too quickly, ask them to stay calm while you help ease the cramp. Panic is a state in which a person is no longer able to reason properly. Actions become solely instinctive and aimed at survival. However, in some cases, the result is the opposite of what is instinctively desired. These are two techniques to help a diver who is panicking on the surface. The first is to circle around them and grasp their tank valve. Then inflate the BCD and block their torso by holding their tank between your knees. The other technique is to go below the surface. Take care when nearing so that you are not struck by their knees. Remove their belt and resurface at their shoulders. Grasp them by their tank valve, block their tank between your knees, and inflate their BCD. The method you choose depends above all on the size of the rescuer and the person being rescued. If the person is a larger diver, it is best to use the underwater method. The last place they will follow you is underwater, and this will allow you to avoid accidentally being hit. One of the most difficult situations that a rescue diver has to manage is panic during a dive. Panicking divers do not respond to external stimuli and risk making an uncontrolled rise to the surface. All you can do is to firmly react to the situation. Trying to make contact with the panicking diver is the first step. Go near the diver, but keep a good safety distance. Let the panicking diver know that they cannot grasp onto you in an uncontrolled manner. Make a sign for them to calm down, and only after they have begun to react to your stimuli, you can allow them to make physical contact. Be very careful of any uncontrolled reactions. If the panicking diver takes off your mask or removes your air supply, it would be very difficult for you to help them. After making physical contact, begin to resurface at a steady and controlled rate. You must not surface too quickly. After getting to the surface, remove the weight belt and inflate your partner's BCD. Good buoyancy will help them remain calm. When a diver realizes that a safety procedure has been forgotten and that decompression sickness could develop, action must be taken to prevent it. After an event of this type, breathing pure oxygen for about 20 minutes is recommended for prevention. One of the worst situations is when a diver is lost underwater. The most important thing in this situation is to find the lost diver in the shortest time possible, while establishing the highest approximation of the point where the diver was last seen. For a successful search, it is required to have suitable equipment, which is not normally part of regular first aid equipment. If it is a boat dive, it is likely that the necessary equipment is on board. The best condition is that the underwater searcher remains in contact with the surface through a diving line. Depending on the crew and available equipment, there are several search methods possible. Managing multiple searches requires collaboration between the diver in the water and an assistant holding the line. While keeping an eye on the line, the assistant on the surface must control the progress of the search, while the diver in the water swims in the directions established by the search plan. In order to communicate, it is important that both diver and assistant are familiar with the line signals. Therefore, before beginning the search, it's necessary to repeat the signals together. The person on the surface keeps the route under control. Using a compass, he sets the range of action where the search takes place and signals the diver when to change direction by giving 2 pulls on the line. At the 2-pull signal, the diver changes direction and pulls the line a little so as to search another area. The technique is repeated with each change of direction until the lost object has been found. When the diver finds the object, they signal the surface by giving 3 pulls on the line. Knowing how to throw a buoy to a diver in distress is one of the skills of a rescue diver. Make sure that you have the end of the line of the float tied securely to the boat, and then throw it as close as possible to the diver, making sure not to strike the diver's head. After having transported an exhausted diver to the boat ladder, you must help them boarding. The crew on the boat should help you, but an SNSI rescue diver with proper training is also able to do this alone. After reaching the ladder, ask for a little help from the exhausted diver, having them hold on to the boat ladder. Remove the diver's belt, the scuba unit, and then the diving fins. the diver will float easily thanks to the dive suit. They just need to hold on to the ladder while you return to the boat. Quickly remove your equipment and then take a line and pass it directly behind the shoulders and under the arms of the exhausted diver. With your back bent straight and resting your weights on your legs, help the diver climb the ladder, one step after the next. Convey trust to the diver in distress, reassure them, and tell them to take it easy. One step at a time, they're going to be just fine. If the dive began from the beach, it is easier to help the diver out of the water. Take the diver to a point where the depth allows to crawl out of the water on all fours. If the sea is calm, you can take off the diver's equipment after transporting them to allow the diver to be freed and lightened of the weight of the scuba unit. If the sea is rough, it is best to have the diver get out of the water with their equipment on and with the regulator in their mouth to avoid accidental inhaling of water. After getting out of the water, make sure that the diver is okay and support them by communicating with them. Being able to independently identify a point on a compass is one of the skills that a rescue diver must accomplish. If you have had other SNSI training, you already know how to complete this assignment, which is part of the advanced SNSI course. However, repeating it will help you improve your skill. At the end of each dive, don't neglect to record what you have done. Recording your dives is crucial for the certification of your diving experience. For all of the dives you make during this course, always remember to ask your instructor to sign your dive log. It is necessary as further confirmation of your work. The SNSI dive recording system supplies you with an elegant colored dive log that you always need to carry along. It is necessary as further confirmation of your work.